Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about anatomy of lumbar spine. So there are normally 5 lumbar vertebrae. The lumbar spine is having the anterior convexity, or we can say normally having the lordotic curve. So the lumbar vertebra structure body, which is massive, having the transverse diameter greater than anterior diameter and height. Arches pedicel, which are short and thick, projected posterolaterally. Lamina are also short and broad. Zygoepiphyseal articular processes, or we can say facets, superior and inferior, vary in shape and orientation. Inferior zygoepiphyseal facet is vertical, convex, slightly anteriorly and laterally. So transverse process, which is long, slender, extend horizontally. Accessory processes are small, irregular, bony prominence on post surface of TP and serves as an attachment site for multifidus and intertransverse muscle. Spinous process, which is broad, thick, extends horizontally. Vertebral foramen, triangular, larger than thoracic but small than cervical. So this is the structure of the lumbar vertebra shown in these figures. We are having the 3 different views, and we can label the different parts of lumbar vertebra as told in this video just before. Lumbosacral articulation. Lumbosacral articulation is formed by the 5th lumbar vertebra and 1st sacral segment, and we are having the lumbosacral angle. So the sacral segment is inclined slightly anteriorly and inferiorly and forms angle with the horizontal known as lumbosacral angle. And the size of angle varies with the position of the pelvis and affects the superimposed lumbar curvature. So if this angle increases, it will result in increase in lordosis of the lumbar curve and increase the amount of shearing stress at the lumbosacral joint. So in this figure we can see the lumbosacral angle, which is usually determined by the line drawn parallel to superior aspect of sacrum and horizontal line. Normally it is 30°. In this figure we can see the intervertebral disc diagram. Like in the center there is nucleus pulposus, and around it in the periphery annulus fibrosus is there. And we can also see the lamina and facet areas. Next we are having the articulation. Interbody joints are capable of translation and tilts in all the directions. So we are having the zygoepiphyseal joints, which are true synovial joints, and the anterior aspect remains in the frontal plane. Posterior aspect lies close to or in the sagittal plane and allow the flexion extension. This is the figure showing the lumbar zygoepiphyseal joint. First figure we can see the posterior aspect, and in the second we can see the superior aspect along with their articular cartilage and articulating processes. So there are supraspinous ligaments which are developed in upper lumbar and end L3 L4 vertebrae. Intertransverse ligament, which are not true ligaments, replaced by iliolumbar ligament. We are also having the PLL thin ribbon like ligamentum flavum thickened, and iliolumbar extend from tip and border of transverse process of L4 L5 attached bilaterally on the iliac crest of the pelvis. So in this figure we can see the different ligaments: anterior longitudinal, posterior longitudinal, supraspinous ligamentum flavum, and then interspinous ligament. And in these figures we can see the sacroiliac and so in this figure we can see the sacroiliac and iliolumbar ligaments reinforcing the sacroiliac and lumbosacral articulation. And in this figure, you can see the different muscles like latissimus dorsi, fascia, and gluteus maximus. So there are three layers of thoracolumbar fascia: posterior, middle, anterior, which stabilize the facet, and interior layer serves to transmit tension produced by contraction of hip extensors to spinous process. So muscles of the lower spine region serves the role of producing and controlling movement of trunk and stabilizing the trunk for motion of the lower extremity. Muscles also assist in attenuating the extensive forces that affect this area. So we are having the posterior muscles, that is superficial layer, and thoracolumbar fascia is the most superficial structure, which is this fascia is attached to latissimus dorsi, gluteus maximus, internal, external oblique, and transverse abdominis. So during flexion from standing position, erector spine is responsible for contracting eccentrically to control the motion. And erector spinae act eccentrically until two-thirds of maximum flexion has been attained, at which point they become electrically silent. So this is known as flexion relaxation phenomena. So posterior muscles, or we are having the deep layer. In the deep layer, we are having the deep erector spinae, which include longissimus thoracis, pars lumborum, iliocostalis lumborum, pars lumborum. And then we are having the superficial erector spinae, which include the longissimus thoracis, pars thoracis, and iliocostalis lumborum, pars thoracis. We are having the lateral muscle, that is quadratus lumborum, which is deep to erector spinae and multifidus. So it is an important frontal plane stabilizer, and also stabilize in the horizontal plane. Quadratus lumborum, acting unilaterally, can flex the spine and also control the rotation motion. If lateral flexion occurs from erect standing, the force of gravity will continue the motion, and contralateral quadratus lumborum will control the movement by contracting eccentrically. Then we are having the interior muscles, rectus abdominis, which is the prime flexor of the trunk, and transverse abdominis, which can mechanically control the sacroiliac joint through significant compressive forces due to the transverse orientation of the muscle. So psoas major is the prime flexor of the hip. It is active only when there is active hip flexion. So this is psoas major. Iliacus causes the interior iliac rotation and thus lumbar spine extension. Provides stability to lumbar spine during hip flexion activities by providing great amount of lumbar compression during activation. And some anterior shear is also produced when it is activated. Thank you. हाय हाय ये क्या हो गया